The global nursing shortage and low retention rates have been a well-recognized issue over the years. The pandemic has exacerbated this issue as healthcare institutions struggle to hire and retain their nursing staff. Causes of the shortage before the pandemic were due to inadequate workforce planning and allocation mechanisms, undersupply of new staff, poor recruitment, retention, and return policies, and ineffective use of available nursing resources through inappropriate skill mix and utilization, poor incentive structure, and inadequate career support. Low retention rates in nursing are often caused by excessive amounts of turnover in the profession. It's believed that low retention rates can be attributed to external attractions, unsuitable working conditions, and personal reasons. The inability to retain nurses has led to a shortage of nurses across the globe. The World Health Organization, the International Council of Nurses, and Nursing Now states there are just under 28 million nurses worldwide, leaving a global shortage of 5.9 million. It's critical that governments act now to reduce the risk of increased turnover among nurses and improve nurse retention. Policies that offer support packages should be instated to register nurses, both novice and expert. Packages should include benefits and offer psychosocial therapy, opportunities to advance in the workplace, tuition assistance to further education, and flexible self-scheduling to allow for a healthy work-life balance. Safe staffing ratios by specialty and acuity should be instated for the safety of both the nurse and the patient to reduce errors and increase the quality of care delivered. Adequate break time should be included and mandatory, with a designated nurse to monitor patients during breaks for safety reasons. Pay increases should be instated to reflect inflation rates. Years of experience should be considered when increasing salaries. Crisis pay should be administered when dealing with an epidemic or pandemic, such as COVID-19. In response to the pandemic, some countries have tried to recruit more nurses and prevent others from leaving their jobs or leaving the profession altogether. They have improved working conditions, encouraged nurses to return to the profession, and increased the number of nursing students in training. Effective policy responses need to be introduced now to improve wages, working conditions, and career prospects. Nurses hold the power to advocate and lobby for change. Strengthening the nursing workforce could better prepare against future pandemics and global emergencies. To implement and develop policies, registered nurses must become part of this process. Nurses should be at the center of all efforts when rebuilding the system in such a way to fix the issue of the global nursing shortage and low retention rates.